Ever wonder what your heart tries to tell you? Pay attention, for it may be sending warning signals of a heart disease. Today, we're diving into a topic that's close to, well, your heart. We're talking about the often subtle, yet vital early warning signs of heart disease. Recognizing these signs early can be a game changer for your personal health and well-being. So are you ready to listen to your heart's whispers before they turn into shouts? Stay tuned as we unveil the 5 warning signs of heart disease that you should never ignore. And if you find our content helpful, don't forget to subscribe to our channel for more health tips and insights. The first warning sign, often overlooked, is chest discomfort. Now, when we say chest discomfort, it's not always the gripping, crushing pain that you might imagine from watching a dramatic movie. No, chest discomfort related to heart disease can manifest in various ways, and it differs from person to person. Some people might feel a sharp stabbing pain, while others might experience a dull, heavy sensation, like an elephant is sitting on their chest. For some, it might feel more like an uncomfortable pressure or tightness that can even be mistaken for indigestion or heartburn. The key here is that it's not normal. It's a feeling that is new, different, or unexpected. This discomfort can range from mild to severe. It can come and go, or it might persist over several minutes. It's not just a fleeting twinge that comes and goes in the blink of an eye. It might even intensify with physical activity and decrease during periods of rest. Now, it's essential to remember that this discomfort usually happens in the center or left side of the chest. However, it's not confined strictly to that area. Sometimes this discomfort can radiate outwards, affecting the arms, jaw, neck, back, or even the stomach. Another key point is that this discomfort might not be accompanied by other symptoms. It can be the only signal your body gives you that something is wrong. But it can also be accompanied by other symptoms like shortness of breath, cold sweats, nausea, lightheadedness, or fatigue. Now, I must stress this point. Chest discomfort doesn't always mean a heart attack, but it's a sign that should not be ignored. It's your body's way of telling you that your heart might not be getting the oxygen it needs, and that's a signal you should never, ever dismiss. So if you or someone else experiences chest discomfort, especially if it's new, different, or not going away, it's critical to seek medical attention immediately. It's better to be safe than sorry. Trust your instincts. When it comes to your heart, it's always better to err on the side of caution. Remember, chest discomfort doesn't always mean a heart attack, but it's better to be safe than sorry. Moving on to the second warning sign, an unexplained shortness of breath. Picture this, you're going about your day, perhaps climbing a flight of stairs, or maybe you're simply taking a leisurely stroll in the park when suddenly you find yourself gasping for air. It feels as if an invisible force is squeezing your chest, making it difficult for you to breathe. You're not running a marathon, nor are you at a high altitude. You're just living your everyday life, and yet you're struggling to catch your breath. This, my friends, is what we mean by an unexplained shortness of breath. It's not your run-of-the-mill panting after a strenuous workout or a sprint to catch the bus. This is a persistent, often unexpected difficulty in breathing that isn't linked to any obvious strenuous physical activity. It could occur while you're sitting down to enjoy a cup of tea, or even when you're getting ready for bed. Shortness of breath can feel like you're not getting enough air or that you're being smothered. It might be accompanied by a feeling of tightness in your chest, or a sense that you're not able to breathe deeply enough. You might feel as if you're constantly needing to yawn or take deep breaths, but even then it feels like you can't get enough air. Now, it's crucial to remember that shortness of breath can be a symptom of many different health issues, including asthma, anxiety, or lung disease. However, it can also be a sign of heart disease, especially when it's combined with other symptoms like chest discomfort or fatigue. If you or someone you know experiences unexplained shortness of breath, it's essential to seek medical attention. It's not something to be brushed off as a mere sign of aging or lack of fitness. It could be your body's way of signaling that something isn't quite right with your heart. Shortness of breath can be a silent alarm for heart disease. Don't dismiss it. Our third warning sign is a sudden feeling of dizziness or lightheadedness. Dizziness and light-headedness can be quite disconcerting experiences. More often than not, they're harmless, perhaps a result of standing up too quickly or not having eaten enough. But when these feelings persist or come on suddenly, they might be more than just a fleeting discomfort. They could be a sign of an underlying heart condition. The heart, you see, is responsible for pumping blood around our body, ensuring every organ, every cell, gets the oxygen and nutrients they need to function properly. When the heart isn't performing as it should, the amount of blood reaching the brain can be reduced. This can cause feelings of dizziness or lightheadedness. Some heart conditions that can cause these symptoms include arrhythmias or irregular heart rhythms and heart valve problems. In certain cases, these symptoms might even precede a heart attack. Remember though, heart disease is complex and these symptoms can be caused by a variety of other conditions too. If you're frequently experiencing dizziness or lightheadedness, it's important to consult with a healthcare professional. They'll be able to conduct the necessary tests to determine the root cause of your symptoms and guide you on the best course of action. We all have moments when we feel like the world is spinning, but if that spinning doesn't stop, it's time to take action. Don't let a spinning world spin your health out of control. The fourth warning sign is an unexplained and persistent fatigue. Now, we've all experienced those days when we feel worn out and tired. It's a common symptom of a busy lifestyle, isn't it? But what if I told you that this fatigue could be a much more significant indicator of something serious going on in your body? Let's delve a little deeper. When your heart isn't pumping blood as efficiently as it should, your body doesn't receive the oxygen and nutrients it needs to function at its best. This can result in a feeling of constant tiredness or fatigue, which often gets dismissed as a side effect of a hectic schedule or aging. But if you are getting ample sleep and still find yourself struggling with fatigue, it could be a sign of an underlying heart condition. Remember, your heart is the engine of your body. Just like an engine that's not running properly can cause a car to stall, a heart that's not working efficiently can cause your body to feel constantly worn out. So if you're feeling unusually tired, don't simply brush it off. It might be more than just a case of the Monday blues or the result of a tiring week. Listen to your body. It knows when something isn't right. A tired body might be a cry for help from your heart. Finally, the fifth warning sign, unexplained swelling of feet, ankles and legs. This is a symptom you may not immediately connect with heart disease, but it's crucial to pay attention to. This swelling is medically known as edema, a condition characterized by an excess of watery fluid collecting in the cavities or tissues of the body. Now, you might wonder, how does this relate to the heart? Well, when your heart isn't pumping efficiently, it can cause blood to back up in your veins, usually in your legs. This increases the pressure and pushes fluid into your tissues, leading to the swelling we call edema. It's important to note this swelling isn't your typical "I've been on my feet all day" kind of puffiness. It's persistent, often worse at the end of the day, and may make your skin appear stretched or shiny. You might also notice that when you press on the swollen area for a few seconds, you're left with a dimple or pit, a sign that fluid is indeed present. Edema is not exclusive to heart disease. It can also be a symptom of kidney or liver disease or a side effect of certain medications. However, if you're experiencing unexplained persistent swelling, particularly in combination with any of the other signs we've discussed, it's important to consult with a healthcare professional. Swelling isn't always a sign of being on your feet too much. It could be your heart calling for help. Your heart is your body's engine. Keep it running smoothly by understanding these warning signs. Let's quickly recap: chest discomfort, shortness of breath, dizziness or lightheadedness, fatigue and swelling of feet, ankles and legs. These are the 5 warning signs of heart disease that you should never ignore. They may seem common or unrelated to the heart, but they could be your body's way of waving a red flag. It's crucial to listen to these messages, to not shrug them off as mere inconveniences. If these symptoms persist, it's not a sign of weakness to seek medical attention. Rather, it's a testament to your strength and your commitment to your health. Remember, early detection can make a world of difference. It can save lives. It can save your life. Before you go, do not forget to subscribe to our channel for more enlightening health discussions. Take care of your heart, and it will take care of you. If you haven't already, make sure to hit that subscribe button to stay updated with our latest health videos. Your heart will thank you.